Good afternoon, esteemed faculty and my dear friends. Radiation therapy is one of the main treatment modalities during the treatment of head and neck cancer. Radiation therapy aims to deliver fractionated radiation over multiple days to an accurately localized lesion to ensure control of the tumor while minimizing the side effects to the surrounding tissues. It is imperative to ensure consistent reproduction of the patient's initial position throughout the course of the treatment. Intraoral repositioning bite block during radiation therapy helps in stabilizing the mandible and minimizing the side effects better than a face mask alone. Temporary materials used such as wax or cork can change shape or break during the treatment, which can lead to recalculation of the doses or cause delay mid-treatment. The other repositioning bite blocks that are used are too complicated to be fabricated and may cause delay in the radiation therapy. This video will demonstrate a simple and a cost and time efficient method of fabricating an intraoral repositioning bite block. This technique not only creates sufficient separation between the arcs, but it is also easy to be retrieved by the radiation therapist. This technique allows for consistent positioning of the patient during the therapy, therefore it minimizes the side effects to the surrounding tissue. This is comfortable as well as appreciated by both the patient as well as the radiation therapist. A full arc bite registration is made in the patient's mouth using vinyl polysiloxane material by pointing the tip on the occlusal surface of the most distal mandibular tooth. Slowly squeeze the cartridge to extrude the material on the occlusal surface of the teeth. Moving the tip side to side, finish at the most distal point of the opposite arc. Instruct the patient to bite down till the material sets. Remove the bite registration and inspect to see if all the structures are visible. The bite registration is placed on top of a sheet or base plate wax to carve the outline of the repositioning bite block and is used to maintain the tongue against the floor of the mouth and as a handle for easy retrieval through the radiation mask. A second sheet of base plate wax is heated and rolled into a cylinder. The wax cylinder is cut in two halves and attached to the base to create separation between the two arcs. The wax is then placed with pillars down into a hot water bath for softening. Indentations of the maxillary teeth are made into the wax and the step is repeated for mandibular surface. The patient goes to the thermoplastic face mask appointment with the wax pattern in his or her mouth. Once the shape is confirmed with the radiation team, the patient is dismissed. Irreversible hydrochloride impression material is poured on one side of the flask and the wax template is pressed in. The surface is coated with Vaseline. The other side of the flask is also filled with the same material and the flask is closed tightly. Once the material has set, the flask is opened and the wax retrieved. Autopolymerizing white methyl methacrylate is poured into the mold. The flask is closed back tightly until full setting of the acrylic. Repositioning bite block is retrieved out of the mold and thoroughly polished for patient's comfort. Repositioning bite block is now ready for clinical use.